Medical dilemma.
Welcome back to Medical Dilemma. Again, I'd like to thank our major sponsors, St. Clair's Medical Center, Makati Medical Center, and LifeQuest Training and Consultancy Corporation. Now, let's continue with the discussion in our third segment. Earlier, we were talking about Dr. Gloria as a general surgeon as well. There was some talk about
Yung
appendectomy among
sa
seafarers.
right, di ba?
Yes.
Kasi sometimes they spend weeks, di ba? Or even months at sea. And kumisan, they choose to do an elective appendectomy para baka mag-rupture yun during this sa sea trip nila, baka dangerous pa sa kanyang life. What do you think about it?
Sa totoo lang, ma'am, parang kasi any as a surgeon, for something you need to be, you have to remove or to perform surgery. We need to have an indication to remove that. For that matter, the appendix. So, for you to remove the appendix, you need to have an indication for me. You need to have an indication to remove the appendix, and in that case, it's appendicitis. And honestly, for me, performing an elective appendectomy for a healthy individual, for that matter, I won't do it.
Dangerous then. It's
it
fraught
will-
with complications too.
Ma'am, it will boil down to risk benefit. Is it beneficial for you to have your appendix removed, or is it risky? Okay, so at that point, ma'am, medyo mag-iisip muna ako, ba't kailangan mong patanggal appendix mo? Ayun.
Father, what is your take on the issue?
Well, first of all, you cannot do or you cannot treat anything or you cannot remove anything when it is healthy. It is against the principle of totality. You cannot remove any part of your body knowing that, well, it is healthy and it does not inconvenience you. It is not diseased, for that matter. Why remove it? But the fact is that if we go to the risk-benefit principle, for that matter, if going to the sea, like the mga seamen, no, would really benefit you, for that matter. And sometimes it's months that you are there. And probably you're thinking that if you might have some appendicitis there afterwards. Well, do you think that it will really benefit you if you remove that appendix, for that matter? Well, this is one of the things which is gray matter, no? That you may or you may not. It's like an option, okay? You may or may not. But one of the things probably that we can do is, well, if you have already opened your stomach or anything there which is already near the appendix, then probably that's the time that you can just remove it. Always with informed consent that you are going to remove the appendix. After all, the appendix is a useless appendage. There does not do anything. I don't know. We still have to look for the function of the appendix, for that matter. Okay?
Yes, Father. That's precisely the argument of people who want to have elective appendectomy. It's useless anyway.
Yeah,
So
when it is already open.
when it's
That there are
open.
other procedures that has been already done or have been done, then it's already there, and you can remove it. But if your skin is healthy, you are so healthy, etc., etc., looks like that it falls down on optional procedures. It falls on optional procedures.
Meaning, Father, if, kumbaga isabay na yung appendectomy
Isabay
kapag
na.
meron ng ibang
Right.
Kasi
Right.
open na rin yung
Open na rin lang
abdomen,
naman.
Oh, kasi for the benefit of our televiewers, elective appendectomy means it's the patient who wants to
Who wants it, yeah.
for
You just
appendectomy.
remove it for no indication
for
at
the
all.
appendix.
Hindi dahil
Oo.
nag-rupture siya or ano,
or
it's not an
sumakit
emergency.
yun, or
So,
tiyan
at the
mo,
option of the patient, parang
Yes.
ganun.
Another
Maybe it's also
issue there.
preventive.
Yeah, that's good. But another issue is, supposing that's not your line. You're not a surgeon like us. We're OB, and we saw the appendix. Can we do it, or should we refer them to you as surgeons? What do you think?
Ma'am, in practice, actually, some OB-GYNs do appendectomy.
They do it.
Yeah.
Okay.
I think, again, it will depend on the areas. Some institutions allow OBGYNs to do appendectomy. But some institutions, you need to refer them. But for formality sake, minsan mo mas maganda ni-refer na lang nila.
Oo.
Yeah.
Kasi what is the risk of being sued if you something happened?
It's better
and that's
to
not
err
your
on
line.
the side of caution, no? Kung
Right.
sa espesyalista
It's an
talaga,
ethical
di ba,
duty.
Father?
Be on the side of caution rather than on the risk. You lessen problems, technical, legal, and even moral for that matter.
Okay.
And that's
Now, we talked about the use of antibiotics to treat vasculitis and other similar diseases. But I've heard a lot of doctors say that as much as possible, try to avoid the use of antibiotics.
Yeah, resistance kasi, no?
Where would an ordinary person go, for if faced by this kind of question?
Can they self-medicate? Sometimes they do that, and they just take antibiotics.
Well, actually, ang common self-medication is a common practice naman sa atin talaga. And a lot of people does it. And the problem with self-medication kasi, ma'am, is hindi tama yung dosage minsan.
right.
Hindi tama yung dosage, saka hindi tama yung duration. Ano yung dosage, kung gaano karami, and then duration, gaano katagal. And normally, ang antibiotic mo is, again, there are guidelines actually. If you really want to, there are guidelines for antibiotics to be used for certain kinds of diseases. Hindi kahit ano lang kunin mo.
Yeah,
Kasi
akala mo.
may hierarchy kasi ng antibiotic.
Correct.
May first line, may second line, may third line, may fourth line. And habang tumataas yan, pamahal na pamahal yan. And patapang ng patapang.
Right.
With
right.
regards po sa resistance, tama po yun. The problem with self-medication kasi, if you're going to take the mas matatapang na antibiotic, mali pa dosage, mali pa duration, so, you will, the bacteria, pag kunyari, for example, kulang yung nainom mong antibiotic, hindi na full dose. So, yung bacteria, and there are a lot of bacteria, ang daming bacteria, ang daming klase infection. And sometimes, pag hindi napatay siya ng tama o hindi siya talaga na control, they will develop immunity to that antibiotic. Okay, so, tama po yun. With regards to antibiotic, there are guidelines in certain drugs that tells you or that guides us to prescribe to patients.
Kaya it's always best to consult a doctor na, no?
Mas maganda po.
So in short, the use of antibiotics, as long as it's supervised by a doctor, is not really harmful.
Yes, sir. Okay lang.
So the benefits outweigh the risks or the negative consequences of using antibiotics.
Well, yes po, pero ang isa ho kasi dyan, sir, ang ano natin dyan is, yung, for example, if you're going to take antibiotic, may nakita yung antibiotic, problema paano if meron kayong allergy?
Right.
Yes.
Meron kang hypersensitivity reaction, adverse reaction po sa gamot na yan, which is, nangyayari po yan. So, yun ang problem, yun yung risk. Risk mo doon is, hindi mo alam kung may allergy ka. But if you're taking antibiotic, kunyari, for example, you're taking this kind of antibiotic, pero ay, nagkasugat ako ulit, inom ako ulit. Problema dyan, kung hindi tama nga again yung dosage mo at yung duration mo, sometimes yung gamot na hindi na maging effective sa'yo. So, baliwala na. Sayang lang.
Okay, so it's always best to go back to your doctor, even if the disease recurs, and you already have experience treating it before.
Yes.
Okay.
That's it.
Now, if let's say a patient opts not to take antibiotics, are there options that, treatment options that don't use antibiotics?
Dito sa vasculitis.
Like
Vasculitis, again, Sani, pagka dumating kasi sa amin yung pasyente, kaya may nakita akong pasyente, ang napapansin ko dyan kasi is talagang malala na yung kondisyon na. Seldom that we see na meron lang konting problema. Sometimes pupunta sa amin yung pasyente, magana yung paa, pulang-pula na yung paa, red na, mainit, so di na mailakad, namamagana yung mga tuhod kasi sobrang infection na. So, pag gaganon kasi, I think there are no options to,
No more options.
no more other options to help resolve the vasculitis. Eh. So, first line then is you need to prescribe the indicated antibiotic and then monitor it. Okay, monitor it meaning usually dapat yan masunod or kahit papaano maubos yung prescribed amount of medications. And then hindi mamimintis. Okay, so then, well, pag-alaga ng problema o ng sugat for that matter.
Are there severe cases where, you know, the life becomes threatened or
Yes.
you might have to have some amputation done?
Isang very common na saying sa amin dito, Father, is pagka pumunta sa amin isang pasyente na medyo matindi na yung sugat sa paa. Okay. Minsan, sobrang tindi na infeksyon, ang infeksyon kumakalat na sa dugo. Yan ang tawag namin sepsis. Sepsis is
Infection.
superimposed infection that kumalat na sa dugo yan and yung infection na-apekto ng puso, baga, kidneys mo. Multi-organ na. So, pag gaganon, kalimitan ang dilema dyan is papipili namin yung pasyente. Life or limb? Buhay mo?
Life or limb?
Buhay mo o paa mo? And
That becomes a dilemma for the patient.
yes. And believe me, Father, ito ho, real life. And I had about 2 or 3 patients na they would choose wag putulin yung paa nila and umuwi na lang sila.
And they just have to endure.
And then
That,
bahala na.
Mamatay sila or what? No?
And honestly, hindi ko na sila nakita. Hindi ko alam kung ano nangyari sa kanila. Hindi ko alam kung buhay pa sila.
Alright,
But a lot of percentage naman is kasi once kung sabihin mong severe infection talaga, papakita mo naman talaga yun eh.
Which means that there is nothing more that you can do
Yeah.
except to
Cut
amputate
off
it.
the limb.
To save his life or her life.
Kasi kung
Father,
minsan,
how should an individual decide given a situation like that?
Well, of course, sometimes it's good that a doctor should counsel the patient to let him understand the importance of that procedure. Otherwise, he suffers the consequences, which may be fatal for that matter. And for as long as the patient is able to understand that, some sort of a dilemma, if he understands that, then probably he's going to decide, okay, doc, I'll accept it. And then anyway, in the principle of totality, that you can sacrifice part of your body for as long as there is a way by which you can, there is a way by which you can substitute something which may not be a complete substitute, but can help you out, even if, for example, you lost your leg. Well, we have crutches, we have wheelchair, etc. You can still be mobile. You can still do your things, even in the office. You can still do computer, etc. And you will not be useless after all.
there's a practice in hospitals wherein you ask the patient if he can get a second opinion. What do you think of that? A second opinion
Definitely, ma'am.
On a
Ako,
very severe case.
from
You
another
can-
doctor, maybe. Yeah.
Lalo na po pagka sometimes some patients will come to you and then you can feel the the anxiety.
Right.
Anxiety. So and sometimes you cannot I myself I cannot convince the patient. I cannot force any medication to the patient. Okay. Hindi ko po pwedeng ipilit sa'yo kung ayaw mo, wag. Pero asang nangyari po dyan, ma'am, is if I will also feel yung anxiety nila.
Predicament
I will
nila,
ask the
no?
patient. I will personally recommend it to them na you can see another doctor, second, third, fourth, fifth opinion. Pero ang sa akin lang po, kasi alam mo yung sinasabi ka, hanggang third or fourth na lang. Kasi huwag kang mag-5, 6, 7. Kasi pag mag-5, 6, 7, gagastos ka na. Plus, malalo ka lang malilito.
Oo, for forum shopping.
Yeah, right.
For
Pero
the
sometimes, doctors have different also opinions, no?
Yeah.
Kaya natin yan. No. They promise everything. Everything will never promise a patient that it's going to be well afterwards. Never. Because in that case, you probably sometimes might be deceiving the patient when you know already that, there's nothing much to do except to amputate it. And he's going to live a normal life, even without a leg. It's still a normal life. Your life does not depend on one leg. Even with two legs, you still become normal. You still as human beings. You have never reduced your humanity just because you lost two legs or one leg for that matter. You never lose that humanity.
Now, Father, if a patient chooses life rather than limb, can we take it against him, or should
Yes.
we take it against him?
Yes, because we must be able to see our life as a whole always. Well, according to Peter Senge in the Fifth Discipline, which is a very beautiful book in management, but something it tells about life, that there is always something in all of us that to put together a puzzle, to see everything as a whole. The beauty of a flower, a poem of a person, is to see him as whole. As a matter of fact, healthy comes from the Old English hal, which means hale and hearty, meaning whole. The unhealthiness of the world comes about when we are unable to see ourselves whole. Hence, the wholeness of ourselves is our being healthy, in spite of the fact that we don't have a leg. We are still whole, and we are still beautiful.
Okay.
That's good.
Okay, Doctor, you...
So that's a predicament that we have, no, mostly.
Right.
I just want, for example,
Yes, Doctor.
what's important, I think, sa patient is that the right of self-determination, Father. He can determine for himself what he wants to do. He did not follow the instructions of the doctors if he doesn't want.
Well, self-determination depends on, well, how about the things that you have to do? In other words, you can only have self-determination if your decisions are really right.
How would you know, Father? How would he know?
For example, in
I
this
mean,
case, the doctor has already told you, 1, 2, or 3 doctors, that we have to amputate your legs. But you chose not to. That is not a
You'd
good
rather die, for
self-determination.
example.
You'd rather die. How can you have self-determination if your decision is towards death? That
As a
is not a
whole.
good self-determination. When you talk about
Yes.
self-determination, is a kind of mental set that gives you everything that is needed by your life to live a healthy life, beautiful life, a marvelous life, a productive life. But in that case, you don't choose to have an amputation. I don't think that will be a beautiful life for you.
Yeah, but Sarah, what do you think? Legally, can he decide not to follow instructions?
Oh,
and
yes.
all?
The patient can decide
Yeah.
legally, can decide against the doctor's orders or against his right to life, for example. Pero I'm trying to place myself in a patient's predicament, like yung dalawang lumapit kay doc tapos hindi na niya nakita. Although we're not assuming that they died because of the vasculitis. Although, as sabi nga ni doc, if dapat yung parang basketball best 2 out of 3. If 2 doctors already told you that you need your leg amputated, then maybe it's best that you decide in favor of life. Because sabi nga ni Father, maybe the quality of life will be affected. However, siguro sa atin kasi meron tayong notion na ganun, ayaw natin na, mapuputulan ako ng paa. I'm just assuming, and maybe it's time that we correct that to doktora. Kasi people should be brave enough to decide in favor of life-saving mechanism like amputating your leg kesa you choose death. Kasi it's not wrong or nakakahiya or embarrassing. It's not a criminal thing, 'di ba? To have only one leg. I'm just thinking kasi maybe our laws here or our infrastructure is not does not favor handicapped people, but nevertheless we should work towards the betterment of everyone. So I think doon medyo nagkukulang yung implementation ng batas, but at the same time it's not something to be embarrassed about. It's not something that is criminal. Hindi yan pag nanakaw sa pera ng bayan, for example, to have a one leg amputated, di ba? It should be something na we should encourage, patients who are facing this decision-making process. It's not something to be ashamed about.
All right, so we've reached the end of our show. Now, maybe we can have a few words for our audience. Let's start with Dr. Gloria. Final words for our audience.
Especially those suffering from vasculitis.
Vasculitis. Yes.
So, kung meron sa parting words lang, if you feel something, okay, it's nice to see a specialist or a doctor immediately para hindi lumala.
Okay.
And then, para maagapan ka agad. And then, para mas mabilis ang recovery.
Okay. Attorney Sarah?
Oh, palagay ko siguro yung in the biblical sense, no, if you're facing a decision such as whether to get your leg cut off in a life-saving situation, then sabi nga ni Lord sa Bible, do not be afraid. So that'll be my parting words for this episode.
Okay, Father Jerry.
Well, as we know that health is doing the best of what you have in your body and in your mind, and maximizing whatever capacities that you have, in spite of the fact that you probably do not have any more legs.
Okay,
Ako
and of course,
naman,
Dr.
it's always
Sanchez.
good to have a second opinion or even a third and get one that agrees with what you believe in. Well, anyway.
Thank you, Dr. Okay, diseases of the vascular system could be life-threatening if left unchecked. Therefore, live a healthy lifestyle, and if symptoms appear, see a doctor immediately to avoid the stranglehold on this lifeline. Thank you for watching Medical Dilemma. Catch us again next week here on GNN, Sunday, 6 p.m. You can also watch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you. Thank you.
Medical Dilemma